Hi, good morning, everyone. Welcome to our Unit 3 discussion. Today we're going to be talking about the decontamination and disinfection of instruments and equipment. So let's get right into it. Like I said, instruments and equipment is kind of the theme for today, and applying those principles of technique for proper decontamination. Talk a little bit about some of the chemicals and the safety protocols that are going to need to be implemented for proper decontamination. So here are your assignments for this week. So this is actually closer to the end of week 3, so we're almost halfway through this entire quarter. Kind of hard to believe already, but you do have quite a few assignments this week. So just be careful with your due dates. These are due on Sunday, with the exception of that first discussion post is always due on Wednesday. And respond to 2 peers. Make sure you're getting 2. Some of you are only doing 1. 2 peers by Sunday. Okay, and also another thing that I've noticed is make sure you're citing all of your sources in APA format. So you can't just post a link and it be good to go. I'll take points off for that. So be checking how to cite things in APA. If you need help with that, let me know. I can help you with that. But a few points here and there can add up over time if you're doing it every week. So just be careful of that. All right, so why is it important for central service techs to know how to handle decontaminated items properly? For one, this is going to be a big part of your job. So you need to know how to do it and how to do it well and safely. Okay, like look at this tray of instruments. There's like pieces of bone here. It's used, it's gross, it's disgusting. So if you're not handling this properly, you could easily come in contact with someone else's human tissue, blood, body fluids, etc. Excuse me, which could put you at risk for, HIV, AIDS, anything like that. So you don't want that. You want to protect yourself, and make sure that you're cleaning it properly so you can protect the next patient as well. All right, so how do we do that? The first thing we're talking about decontamination is point of use preparation. Okay, so point of use is like what kind of as it says, while you're using it, preparation, and then transport. So this typically happens um, in the operating room or maybe the ER if that's where you're using those supplies. But point of use, and as a surge tech, I always tell my students, or I practice, as soon as I used an instrument, I would wipe it down. Okay, every time that surgeon would give an instrument back to me, I'd wipe it down, keep it clean so it didn't build up with a lot of gross debris. Okay, so gross soil, not that it means icky, which sometimes it does, but gross soil means any tissue, body fat, blood, or other substance that is built up on that instrument. So it's usually visible, gross soil. Okay, so it's easier to remove or easier to clean if you remove the gross soil. Otherwise, like I said, it builds up. It gets really sticky, gets really in those crevices of the instruments, and you don't want that. It could also lead to instrument damage over time, and it helps prevent cross-contamination later. And, it just keeps others safe, just keeping things clean, neat and orderly. So sources of contamination include the instruments and equipment. You could even dirty up the case carts as you're returning these dirty instruments from the operating room. So a lot of facilities will have a machine, or like a really big washing machine, I guess you could say, that cleans the case carts as well. You put them in, it's a case cart cleaner, and it washes it like a washing machine. So they come back out clean. So there is no cross-contamination there. And you will also have other used items from other departments, like I said, like the ER. Okay, so instrument decontamination, again, begins at the point of use. That's on the person that is handling the instruments while they're being used. Okay, so prolongs the life of the instruments because those metals do break down over time, even though they're typically made of either titanium or a type of stainless steel. they still can break down over time. And if it dries on there, it is much harder to clean off. So you're going to be doing an assignment where you have to actually clean the instrument yourself. You're going to put something gross on it, and you're going to see how hard it is if it's been sitting overnight for that instrument to get cleaned. Okay, and tissue and moisture promote something called biofilm. So this biofilm, look down here, is a way that bacteria adhere to a surface. So it's like the bacteria's own little self-preservation method, so to speak, because that bacteria wants to stay alive. So it's going to do anything it can to keep from getting killed, essentially. So it makes this really sticky surface that it allows it to stick to anything and makes it very hard for it to be removed and killed. So biofilms are a little trickier. That's not quite a spore, okay? Biofilm and spore are not the same thing, but it's just a way for that bacteria to try to stay alive. So we want to make sure that we don't give it a chance. So some point of use guidelines. It does not replace the cleaning process. It still has to go through that entire decontam process. Okay, the whole purpose is to remove the gross soil from the instruments. Okay, follow IFUs. You know, sometimes you can submerge, let's say, a hemostat and scrub it down in maybe a basin of sterile water. You probably couldn't do that with a very expensive, delicate scope. So follow your IFUs. Always keep your sharps separate. Don't put a loaded scalpel in this basin to clean before you send it to decontam, or send it to decontam that way, right? So keep your sharps separate from anything else. Always separate your linens that need to be re-washed appropriately. Don't send linens with trash to get thrown away, or in the case cart with instruments, even if it's just a towel. Okay, those need to be separated. Always remove disposable items, because sometimes you might get somebody down in decontam who hasn't gone through a certification process, excuse me, and hasn't, fully learned what could be disposable or reprocessed. And then maybe this disposable item gets reprocessed. That's not going to be safe for use because it wasn't meant to be sterilized. So as the person at the point of use, you're going to know what's disposable and what's not. So place them in an appropriate container. Always open your hinged instruments and disassemble anything that was put together. So that's going to help the person in decontam. Okay, anything that's ratcheted shut while it was being used needs to be opened so those ratchets can be cleaned. And this is true of really at any point, but heavy instruments are always on the bottom, light on top. There are some trays that have both like delicate forceps and maybe heavier retractors. So you would want the heavier retractors on bottom so you don't damage, obviously, the delicate instruments. This one's a little tricky from a surge tech perspective. Sometimes it's difficult to keep instrument sets together. I will attest to that because, there might be cases where I have 5, 6, 7, 8 trays of instruments on my back table. Some of them have very similar items in them. So it can be tricky to keep those together, but it would be beneficial in the long run to do that. Also keep instrument moist. Remember, it's more difficult to clean instruments later if that stuff, that tissue, that body tissue got dried on there and caked on. It's a lot harder to get off. And then also if there's ever instruments that need repaired, they need to be tagged appropriately, not just shoved back in the mix and then lost again in the process. All that's going to do is allow that instrument to come back up later to be used by the surgeon again, and it won't work. So it's not good for the patient to not have instruments that work. All right, so transporting. If it was used in patient care, consider it contaminated, even if you cannot see that it's visibly dirty. So if it got opened in that patient's room, it's dirty, it's contaminated. So it has to be reprocessed appropriately. Always wear gloves. Anytime you're ever touching anything that was near or on a patient, or you're in the room with the patient, always wear gloves, always. Splashing can be a concern, especially in decontam. You're going to have, we're going to talk about it in a minute, but the 3-sink process of cleaning those instruments, you're going to have like water, chemicals in those waters. You want to make sure that you're not getting that in your eyes. So wear the appropriate PPE, especially for your face shield, glasses, hats, all of that. If you're transporting carts, pay attention to where you're going, okay? That seems pretty self-explanatory, but these carts can be tricky to push. Sometimes they have like a rogue wheel that doesn't want to work. There's always that cart, right? It's like going to Walmart, your buggies don't work. Um, so it's the same concept at the hospital. They can be difficult to push. You don't want to accidentally run your cart into the wall or somebody else, and then all of this contaminated items spill onto the floor, right? That would be a disaster. You don't want to spread the dirty. You want to keep it contained, right? And then never leave soiled items in a cart unattended. So if you just need to pop into a room real quick to get something or whatever it is, you can't leave it in the hallway, wherever it is, especially if it's in a common hallway where patients and their families are walking by. So put it where it needs to go and then go back and do what you have to do. All right, so what's the definition of clean? Okay, clean does not mean sterile. So it just means you've removed all the soil and foreign debris, all of that built up bioburden, okay? Even if you can't see it, visible and non-visible. The presence of pathogens, notice it says minimized, not eliminated, minimized to a way that you can handle it safely now with your hands, bare hands. To clean something requires the right tools. That way you can see what you're doing. You know that it was effective. If you don't use the right tools for the job's probably not going to be effective, right? And if it wasn't cleaned properly, it can't be then sterilized properly. So clean and sterile are two different things. Clean just makes it safe for you to handle. It's going to then later go through that sterilization process. But if you left a big piece of, let's just say, bone from a bone cutter or something on an instrument, and then you left it on there and we're going to send it through the sterilizer, it's not going to be sterile. You cannot sterilize living tissue or non-living tissue. It doesn't matter. You cannot sterilize that. So even though it went through the sterilization process, that instrument, whenever that surgeon opens it and sees that piece of bone, they're going to send it back. They will not use it. It cannot be used. Okay, so let's talk a little bit about the decontam area itself, like how there are a lot of very specific things that go into this area because it has to be done properly. Like I said, if you don't decontaminate it properly, it will not be sterilized properly. So this area is where you're receiving it's like the first step in the cycle of use. Receiving the soiled and used supplies to be cleaned. Okay, they get cleaned here. So it's cost effective to centralize decontamination. And you had that discussion about, is centralization, effective, a good idea? And I got a little click happy here, so sorry. But it is cost effective. That way, all areas of the hospital have access to it and it's less, it just doesn't cost as much if you have just one department, right? So location is important. Typically, you're going to see it located very close to the operating room because that's going to be where they receive the majority of their soiled supplies. So in most facilities. And now if you have multiple, like for example, I went up to Ohio State University and they have like 6 different individual operating rooms, each with their own unique needs. But they still had a centralized kind of in the middle of all those decontam areas. So location is very important. Even down to the floor, the walls, the lighting, all of it is very specific. When we start talking about the central sterile processing area, the OR, very specific because it has to be done correctly to maintain, clean areas, sterility, etc. So floors and walls must tolerate chemical cleaning. They have to be made of something that can put up with that on a daily basis. Even the ventilation, how much air is coming in and out of the room. Minimum of 10 air exchanges per hour. That to me, when they throw out numbers like this, pay attention because those are commonly certification questions when you go take your certification. They love to ask those types of questions. So 10 air exchanges per hour under negative pressure. That way you don't have any of the dirty air, so to speak, leaving the room. It stays in. That's important. And then the temperature should be roughly between 60 and 65. And the reason for that, for both of these, temperature and humidity, is to prevent microbial growth. Now, some bacteria really love a higher temperature, like 75, 70. They thrive in that. So you want to minimize that, even giving them an option. Same with humidity. A lot of them thrive above 60% humidity. So it's very humid above 60%. So maintain 30 to 60% humidity in the room. So here are the 3-sink arrangement in your decontam area. I told you we'd talk about this. So you start over here with the wash sink. Then you have an intermediate rinse sink and then a third final sink. So in the wash sink, this is where you're going to start with your water or detergents, enzymatic cleaner in it. So you can see here that there's a lot of soap pumps, etc., that go with it. Notice the water temp here should be between 80 and 110, so it's pretty warm in that case. Warm enough that it might actually start killing bacteria instead of it thriving. And then always check your IFUs for chemicals. That's something you don't want to mess up. Okay. And then your intermediate rinse sink is for rinsing. So you're not going to have a detergent here. It's for rinsing that off with plain or softened water. So it helps get rid of some of that was left on it here. Change water frequently for sure. And then your final rinse is to get rid of anything else that didn't get rinsed. Essentially, you want to really rinse it. So it prevents chemical residue buildup or any mineral buildup. So you're using in this one distilled, deionized, or reverse osmosis water, as opposed to just plain or softened water. So after that, it could go to the ultrasonic cleaner. Sometimes they're called sonics. We always just call it the ultrasonic. So it is used for cleaning. Again, this is not a sterilizer. It is used for fine cleaning, and it really helps get rid of the microbes that you cannot see with the naked eye. So it is kind of unique in that it uses sound waves. So you're going to put them in here, and it's literally going to shake it so fast with sound waves that it vibrates and produces something called cavitation. So down here it says cavitation is what the ultrasonic uses that creates low pressure bubbles that actually burst inward, okay, like towards the instrument and dislodge that soil from the instrument that way. So it's kind of unique. If you're putting anything with a lumen in this ultrasonic, it needs to be filled with fluid. So a lumen is like a hole. Like if you have a Fraser suction or any suction tip, it has a hole down the middle. That's a lumen. So fill it with fluid, and then like the cleaning process before, all hinged instruments should be opened. You want to get in those ratchet areas. Okay, so let's briefly talk about some detergents. Here are your categories of detergents, you could say. So you have emulsifiers, surfactants, and chelating agents. An emulsifier in any kind is something that is going to bind two substances together that don't typically combine. Best example I could give you is oil and water, just to give you an idea. Oil and water, do not mix, right? So if you have something, like let's just say you're baking, you put oil and water in your brownie mix, something else has to be in there for it to bind together. That's an emulsifier. Same with making mayonnaise, right? Eggs is the emulsifier in mayonnaise because oil and water don't mix. So you'll have some of these in some of your detergents. Okay. Surfactant is something that lowers the surface tension of water, which is going to increase solubility or how much it can be dissolved into it. So a surfactant. And then chelating agents is something that specifically binds water to minerals in the solution. That way it says it prevents detergents from reacting with the minerals themselves. Those are some of the categories you'll see here. All right, so a couple and very important key cleaning guidelines. So pre-cleaning, you have a couple like steps here with cleaning. Pre-cleaning is at the point of use. It's just another term for that we talked about. Manual cleaning is something you do by hand. And then mechanical cleaning, like for example, the ultrasonic, is using some sort of equipment. So you're going to see all of these done in the cleaning process before it can be sterilized. So it seems like a lot, but you have to be meticulous with this stuff so you can clean it appropriately and sterilize it. A lot of these we've mentioned before, opening your instruments, always disassemble multi-parts. Lumens filled with fluid flushed, and you use a brush down it. Make sure nothing got built up in there. If it's non-immersible or it's very delicate, set it aside. Don't accidentally submerge it in the water. Ortho instruments are special because those get to be the dirtiest, so to speak. You're going to have the most amount of bioburden, probably, I would say, on ortho instruments, just because ortho cases are bloody. You're going to be cutting through bone, a lot of tissue. It gets built up on those instruments. So make sure you're using a bristle brush on those types of instruments, and always separate your delicates like laundry. So let's talk about disinfection. So this is the process used to make something safe. That's what we've been talking about the entire time here, really, for handling and then reprocessing. But how do you choose what disinfectant, what item needs properly disinfected a certain way? So we use something called the Spalding classification system, something that, was made to easily identify, based on patient contact, what types of things need to be sterilized a certain way. So this little chart's pretty handy. So look over here at patient contact. If we have intact skin, that means no incisions have been made. You're not seeing deeper into the body through the incisions or something. These are things that stay on the surface. So your blood pressure cuff, your maybe your pulse ox that goes on the finger, a stethoscope, those things are considered non-critical because they're not coming in contact with like deeper tissue. So the type of disinfection that this needs is pretty low level, or it could be intermediate depending. So mucous membranes, like let's say into the nose, or this right here looks like an EGD scope. So mucous membrane would be through the mouth and into the stomach. Semi-critical. Oddly enough, EGD scopes do not have to be sterile, okay? The mouth isn't sterile, so that's the thought process there. So it requires a high level disinfection. And then the third category is sterile items. So deep in tissues, we've made incisions, maybe you're in the abdomen, heart, whatever. Those are sterile items that would never typically see bacteria, right? So examples, your instruments that go deep in body cavities. Those would be considered a critical item that have to be sterilized. So that is your Spalding classification system. So some more terms related to disinfection here. We've talked about a few of these, but bactericidal, anything cidal is to kill. So relating to the destruction of bacteria, kills bacteria. A disinfectant kills most pathogens, including bacteria, but not all spores. The only thing that kills a spore is something that will render it sterile. So a disinfectant does not sterilize. A high level, so you have a couple levels here, high level disinfectant will destroy almost all microorganisms, some spores, but not all. Intermediate, you've got, most of your pathogens here destroyed, but maybe not all of them. And your low level, it says destruction of some vegetative forms of bacteria, no spores again. So let's talk about some of these that might require a different type of cleaning. So these categories, endoscopes especially, require special things. So what are some of these? Endoscopes can be classified like 3 different ways here: rigid, semi-rigid, or flexible. A lot of types of scopes. Scopes are used to visualize different parts of the body. So all of these really vary in size and sometimes length, depending on their use. But rigid, as it shows, does not bend. So these are very delicate. Never place anything heavy on those. It will bend where that light and and the camera scope itself is, and it won't work anymore. And they're expensive, so be careful. Semi-rigid, like it's thin enough that it could bend a little bit, but it's really not meant to bend a lot. So it has some flexibility, but not a lot. Used often in urology for cysto cases. And then flexible literally will curl and bend and go through like different nooks and crannies of the body if needed. Some examples here: bronchoscope, gastroscope, colonoscope, cystoscope, laryngoscope. So using your med term, scopes are instruments used for viewing. So what does the front term mean? This is the word root. Broncho means bronchus, into the lungs, the bronchi. Gastro means stomach. Colono is your colon. Cysto is bladder, and laryngo or larynx is your voice box before you get to your lungs. Okay, so how do we care for these endoscopes? A lot of them, if you look back, let me go back here. Okay, especially this one. This one right here is this little adapter. That is a light cord adapter. So you'll see those often on scopes. There's special things that maybe get screwed on or placed on that have to be removed. So light source adapters and valves come off. You're using a neutral pH solution. Always wipe down the outside first with a soft cloth. And then you're going to brush the working channels. So a working channel, you go back and kind of see like this extra little post here or kind of right here on this flexible scope. That is a working channel that you can put like maybe a biopsy brush into. You know, you're putting something in to grasp something from the inside. So flush those. Lint-free cloths you need to dry with so the lint doesn't build up and get back into the patient. And then because, like I said, they're very delicate, never place anything on top. And then these flexible scopes have a very specific order in which they have to be cleaned. And usually near that scope sink where you clean those specifically, it'll have a nice little chart for you in case you forget. It's like a checklist. You want to go through the checklist. So you have to pre-clean. You always check for leaks, then a cleaning cycle, and then the HLD stands for high level disinfectant. And sterilize is kind of a misnomer here. Then you dry it and store it appropriately. Okay, so those are our cleaning, disinfection, and kind of specialty items that require a little bit different decontam methods. So if you have any questions on any of that, please reach out to me. My office hours are on Tuesday. If you can't do that or you need something else, just reach out. We'll try to make something work, okay? But we're almost halfway through this quarter, so keep up the good work. You guys are doing a great job. And again, feel free to reach out. Bye.